I'm Dr. Susan Love, the Chief Visionary Officer of the Dr. Susan Love Research Foundation. Our mission is a future without breast cancer, and we do that through innovative research into the cause and prevention of the disease. Inpatient Science is a series of videos that we've made to help explain to you the options for treatment and guide you along the way.
You've been diagnosed with breast cancer. Once anyone hears the word cancer, it's hard to hear anything else.
The first thing you need to do is to take a deep breath.
The first emotion many women feel after a diagnosis of breast cancer is shock. How could this be happening to me?
This is not your fault, so don't blame yourself.
The diagnosis of breast cancer is not an emergency. You have time to catch your breath and figure out the best path for you.
Be patient. Let it sink in. We have to figure out what kind of breast cancer you have before we can explore your options.
So before even considering your treatment options, it is important that you understand what your doctors have found and where they have found it. Virtually all breast cancer begins in the milk ductal system. Some begin in the ducts themselves, and others in the lobules that are at the ends of the ducts. If your cancer is contained within the duct, it is called ductal carcinoma in situ, or DCIS. If it is in the lobule, it is called lobular carcinoma in situ, or LCIS.
It's important for you to realize that these in situ lesions are not considered cancer and they're not life-threatening.
If abnormal cells are found in the breast tissue surrounding the ducts or lobules, it is called invasive breast cancer. The cells have escaped the ducts. If mutated cells are found in any other organ, it is called stage 4 or metastatic breast cancer. Once you know what you have and where it is, your medical team will make recommendations for your best treatment options. We will be looking at the different types of breast cancers, the variations in the biology of breast cancer cells, and available treatment options for each type.
It's going to feel like a long road, but we'll be with you every step of the way. At the Dr. Susan Love Research Foundation, we'd like to end breast cancer. But until we do, we want to make sure you understand what your choices are. If you want to support us, go to drsusanloveresearch.org, or you can join one of our programs and help us get to the end of breast cancer.